Hello everyone, welcome to a video. This is not a Drug Mythbusters video. I decided I wanted to do something a little bit more unscripted, a little more freeform, something a little quicker that can bridge the gap between the Drug Mythbusters videos that you have come to know and love. So this is going to be just me trying to get some stuff off of my chest, okay? Just trying to get these ideas I'm just trying to get the ideas out of my brain. You know, I've got these voices, I got these thoughts, and I just want to get them out of my head. You know what I'm saying? Totally sane person, totally normal. I love being normal online, but this is just me being normal. So the first thing I want to address, the elephant in the room, of course. You know, something is obviously very different here. You may have noticed something a little bit different than usual, which of course is the fact that my microphone here is attached to a glass pipe, the same sort of pipe that's used by crack cocaine users to smoke crack cocaine. Of course, that's not what I use it for, but you know, it's a little dirty, so you know. And it's got a nice little smiley face on it. I don't know if you can see that. Hang on. Anyway, so the subject that I want to talk about today is psychiatric medication, and more specifically, how patients are informed about psychiatric medication before they use it. So there are a lot of problems with the way that doctors inform their patients about the medications they're taking. And one of the most important factors when we're talking about this is the idea of informed consent. That is, when you consent to a medical treatment, you need to have enough information to be able to make that decision properly. So if you're missing important information about a treatment, then that's unethical. You're not really consenting because you don't know what you're consenting to. To give an example, if you're going in for a surgery and the doctor doesn't tell you that, oh, as a side effect of you getting this surgery, you're not going to be able to walk for 6 months. That's a really big thing that you would want to know before you made the decision about whether or not to get the surgery. But regarding psychiatric medication and psychiatry, I want to talk about my personal experience a little bit. I want to start with an example that mirrors some experience that I've had, and mirrors to a lesser extent the experiences that a lot of people I've known have had. So I want you to kind of do this thought experiment with me, okay? Just try and follow along, right? So let's say that you're a student in America, and you're very depressed, you're very anxious because you are a student in America. You've got a lot of stresses in your life, your economic prospects are not looking great, things are tough. And so your mental health begins to become a really big issue in your life. Your productivity is suffering, and because your productivity is suffering, your mental health is causing your productivity to suffer. And then because your productivity is no longer very good, your mental health is getting worse. And you're getting sucked into this vicious cycle of depression and anxiety and inner turmoil. And your life is falling apart at the seams. So it's a really awful position to be in. And you decide it's time to get help. You go to a psychiatrist, and the psychiatrist gives you a prescription for Prozac, also known as fluoxetine, or some other SSRI antidepressant. They sort of all work in the same way, so it doesn't really matter. But you get a prescription for antidepressants, and you walk out, and you begin taking them. You know, your doctor gave them to you. You trust your doctor. You start taking them. Maybe he told you that they take a couple of weeks to start working and that you might feel a little bit worse as they begin to kick in. But in general, you're pretty confident and you take them, and it's going pretty well. After a few weeks, your anxiety begins to melt away. Your depression gets less. You're able to keep up with your work. You're feeling less overwhelmed by everything. And you're capable of communicating with people for the first time in a while. You're capable of talking. You're capable of processing emotions correctly. And it's going well. The medication is helping. So a little more time passes, and you begin seeing a therapist, a talk therapist. And you start working through your issues really at the root of the problem. You start addressing, why are you depressed? Why are you anxious? What can you do to make your life better? How can you improve your mental health long term? And as you're going through the process of therapy and you're getting more and more mentally stable and mentally healthy, you start getting some weird side effects. Occasionally, it feels like your brain is being shocked by electricity, and you find out that there's things called brain zaps that your medication can cause. It's a very strange feeling. It's almost like having someone plug in an electrical cord into your spine, and maybe you get sexual side effects. You get loss of libido, or you're incapable of orgasming. And while your mental health is better on average, occasionally you are overwhelmed by suicidal ideation. And it's much worse than it was before you started taking the medication. And so, it's helping in general, but you think to yourself, these side effects are strange. And I've been doing therapy. I feel like I can go off the medication. I feel like, the medication has served its purpose, and I think I'm ready to go off of it. Okay. So you just stop taking it. And a day passes. You feel totally fine. You feel the same. A couple more days pass, and you start to feel different. You feel strange. But you're not sure exactly what the feeling is. It's just different. Then, on the fourth day, you wake up to the most intense brain zap you've ever had. It feels like you're in an electrical chair and you're being executed. You feel incredibly strange and nervous, and you have this overwhelming sense of impending doom. You're sweating, you're nauseous, you have a migraine. Everything is wrong. Everything feels wrong. The next day, things are even worse. You can't get off the couch. You're incredibly depressed. You have no motivation to do anything. You feel terrible. You're crying for no reason. You're having panic attacks. And in general, you're far worse off than where you were before. You're experiencing something called rebound depression or rebound anxiety. And this feeling doesn't stop. It goes on day after day for weeks before it starts to get better. And when it does get better, it gets better slowly. Very slowly. It just slowly fades away. And within a few months, you're back to normal, but you think to yourself, why didn't my psychiatrist tell me this could happen? If I had known that coming off of this shit would be that hard, maybe I wouldn't have taken it. If I had known that it would have been this difficult, maybe I could have tapered off slowly, or I could have, figured something out where I didn't have to go through all that. You should know the risks of a drug that you take before you take it. You deserve to know what you're putting in your body and what it's going to do to you, right? When a doctor doesn't tell you about that stuff, he's violating informed consent. No. When a doctor doesn't tell you about these potential side effects, when he doesn't give you the full story, that's not fucking it. I did it again. When a doctor doesn't tell you about these potential side effects, when they don't give you the full story, then they are violating your informed consent, which is a basic ethical right that we all have. Of course, SSRI withdrawal, Prozac withdrawal, these are not a deadly condition. The deadliest part of it is potentially the suicidal ideation and the rebound depression. So the only real risk is suicide, but it's not physically dangerous. And while SSRIs and most antidepressants aren't really lethal, some drugs can be. Benzodiazepines such as Xanax or Valium can form a really intense physical dependence that can cause a very dangerous withdrawal. Furthermore, it's a lot easier to overdose on benzos, especially if you mix them with alcohol or opioids or certain other medications. You can overdose very easily. And many people have died of benzodiazepine overdose before. Many more people have died of benzodiazepine overdose than Prozac overdose. Benzodiazepine withdrawal is often described as one of the worst drug withdrawals that you can go through. It includes things like severe, hours-long panic attacks, hallucinations, delirium, delusional behavior, psychosis, seizures, coma, permanent brain damage, and in some cases even death. Benzos are one of the few drugs that can kill you when you go off of them cold turkey. Take a look at this clip of a woman who is suffering from Xanax withdrawal.
I thought I almost died last night. Part of me was scared. Part of me embraced it.
Her words, a window into the hell that is withdrawal from years of Xanax.
The symptoms are endless. They're just endless. I mean,
For 10 torturous months, she weaned off the benzo Xanax.
burning skin, nerve pain.
Barely able to sleep or walk, rarely out of pajamas. Those strangers, many also struggling to get off benzos, share advice in multiple Facebook groups. Nimcheski shared some of her posts with us.
I am only fighting at this point because I have a son. I'm crying out to God, literally, either take me or make me better.
She made it to better. Today, she's been off benzos 7 months.
So as you can see, this is a woman who has lost everything. She's lost the will to live. She has no will to live for herself. She doesn't think that her life is worth living when she feels like this. The severity of the withdrawal can be crippling, and yet it is so common for doctors not to tell this to their patients. Benzos can cause you to pass out while you're driving. They can cause you to become extremely disinhibited and do things that you regret. They can cause you to compulsively take more and more of the medication until you black out. They can cause you to lose memory. They can cause you to become violent. They can cause suicidal ideation. They've been linked with early dementia. And that's just from when you're using benzos. The situation can get even worse when you stop using benzos. If you are taking high daily doses of benzodiazepines and then you stop cold turkey, it's pretty much guaranteed that you're going to develop a condition called delirium tremens. Delirium tremens is also known as DT, but DT is a medical condition that causes delirium tremens, and delusional behaviors and hallucinations. And it has this very distinct tremor. You shake, your body shakes. And alcoholics refer to this condition as the shakes. It's what happens when you are taking a sedative in high doses every day for a prolonged period of time. And so your body becomes dependent on that sedative to balance itself out. So when you're no longer being sedated, since your body has adapted to those conditions, you now have, to oversimplify it, too much energy. And that energy goes into your body. That's what the shaking is caused by. And it goes into your brain. And so you will start to see things that aren't there. You'll stop sleeping. You'll have a lot of mental, cognitive, psychological issues that can cause you to act in ways that no sane person would. And this isn't just a danger to you, it can be a danger to the people around you. People going through DT have assaulted people. There have even been a few kind of famous murder cases of people who are going through DT. It's no joke. But it's funny that doctors don't tell you that this can happen when they give you a medication, can prescribe them out, and they only have this abstract notion of the side effects, but they don't even tell you that. I don't blame doctors for this, but I think part of the issue is that doctors often see themselves as mechanics for humans instead of healers, or however you want to phrase it. You know, if you're depressed, then your engine, your brain, simply has a chemical imbalance, has an issue that can be fixed with the right parts, right? And that part is a drug that increases the amount of serotonin in your brain. And again, this isn't their fault. Doctors are incredibly overworked. Studies have shown that they spend more than 2/3 of their day just doing paperwork. I have a feeling if they had more time, they'd be able to have a less mechanistic approach to their patients. But like the rest of us, doctors are under a lot of pressure to succeed and be productive in their job, even if that's at the expense of human wellness. And for them, productivity isn't measured in whether or not you really help someone 10 years down the line. That's not a metric that their boss can use. They measure productivity in how many patients did you see? How much paperwork did you fill out? How many hours did you work? How many prescriptions did you write? So you run into this issue where doctors, even if they have the best of intentions, are forced by this system, by the institution they work for, to just push patients through as quickly as possible without really taking a deep look at what is best for that individual patient. Of course, I don't want to be too grim here. The situation is improving in some ways. It's definitely improving in certain ways. For instance, less than 30 years ago, benzodiazepines were ridiculously easy to get. If you had panic attacks, insomnia, anxiety, general nervousness, even restless leg syndrome, you could easily get a Xanax prescription or a Valium prescription or whatever. They were handing them out like candy for about 30 years. But psychiatry has changed. The first benzodiazepine drug was invented in 1955, and they didn't begin getting prescribed until the 1960s. By 1977, benzos were the most commonly prescribed medication on the planet. And then the medical community started to notice the side effects. They started to notice the dependence and the withdrawal and the delirium tremens and the aggression of people who were coming off of it and how painful it was for them. They saw that patients were going through withdrawal the same way severe alcoholics were. And so they began to realize that maybe daily heavy use of benzodiazepines is not a good idea for most of the patients we're seeing. Maybe that shouldn't be the first line option when a patient has an anxiety issue. But even so, they're often prescribed without an adequate warning about the potential side effects and the dependence and all of that. So doctors have recognized this as an issue, but they're not communicating it to their patients properly. Doctors often understate or skip over or gloss over the subjective effects of these substances. And I think the reason they do that is because they don't have any subjective first-person experience with those substances. People talk about the opioid epidemic or the benzo epidemic or the meth epidemic, but I think the real epidemic here is an epidemic of ignorance. And also poverty and late capitalist despair, but we're not going to get too political here. Ignorance is a plague, and the way that we fight that plague is by getting psychiatrists to properly inform their patients. And like I said earlier, people have a right to know what the risks of the drugs they're taking are. But just telling people what might happen based on an abstract understanding of how it might feel or what it would be like, it doesn't really cut it in a lot of cases. So I have a very, very radical proposal. I think that doctors should get a taste of their own medicine. I think that doctors should try the drugs that they prescribe. Of course, I'm not saying that every psychiatrist should take every psychiatric drug, but I do think it would be helpful if they had some genuine first-person experience of the things that they are giving to other people. Firsthand experience is often really undervalued in the world of science, but it wasn't always that way. If you read older scientific papers, especially papers about drug use, you'll notice that a lot of them have this narrative description element to them. Scientists would take the drugs that they are writing about and then give a qualitative account of how it felt. They would, explain, what sort of visuals they had. If it was a psychedelic, they'd explain what sort of effects it had on their heart rate. And they would try it themselves, and they would feel it, and they would understand in a way that a lot of doctors don't understand nowadays. When you're seeing a therapist because you're depressed, if that therapist has experienced depression before, then they're a better therapist. They know how to support their patients because they know what their patients are going through. They have firsthand experience. Living through an experience teaches you about that experience in a way that getting secondhand information just can't. For instance, in many indigenous cultures, shamans or medicine men will take the medicine that they're giving to their patients with the patient. Ayahuasca and peyote are two notable examples where the shaman is usually tripping with the people that come in to get fucking twacked on space drugs. Those are two notable examples, but this is also something that happens with non-psychoactive medicine. And it's not just indigenous cultures either. MDMA is about to be approved by the US federal government for treating traumatic disorders. And a lot of MDMA therapists find that taking a low dose of MDMA with their patients helps them treat the patients better. Many MDMA therapists and psychedelic underground therapists find that when they are on the same level as their patient, when they're experiencing the same thing, that it can be a mutually beneficial experience. And not only does it help them understand the patient, it gives the patient a sense that they're being understood. It gives them a sense of solidarity. And an important component of the placebo effect, which is a very real part of every kind of medicine, even effective medicine that works without the placebo effect, when you add the placebo effect on top of that treatment, it gets even better. You're more likely to take your doctor's expert advice. You're more likely to believe them. And, if they tell you you need to lose 10 pounds, you'll probably consider it a little more strongly than if you didn't have that doctor who had that connection with you and had that shared experience. Of course, I have no idea how we would actually implement doctors taking the drugs that they're prescribing. No clue at all. Maybe in medical school there would be a class where you would take antidepressants or antipsychotics or benzos or whatever, just a couple of times or for a very brief period, just to get a sense of how it feels. Maybe we should just allow doctors to sample their own products. Maybe we should just be a little more laissez-faire about allowing doctors to sample their own products. I don't have a specific proposal on how this should be done, but I think maybe it's something that could really help in certain circumstances. Maybe I'm crazy. Maybe this is an insane idea. Maybe I'm being totally absurd and this is ridiculous. But whatever the case is, though, that's really all I have to say. Until we have a beautiful future where doctors can be getting loaded all the time, take care of yourself, test your drugs, and stay safe. So, like I said earlier, this is a new series that I'm trying out to bridge the gap between the Drug Mythbusters videos. So those videos take a lot of time to write and shoot and edit, and even uploading takes hours because they're usually very long. But I figured I would do something a little easier to crank out to give you guys some content in the meantime. So if you like this, let me know in the comments. Shirtless rambling is basically what I do best as a human being. So I figured this would be a nice little series I could start. For those of you that follow my Instagram account, you know that I am shirtless merely because my apartment is far too hot, and this is not a desperate attempt to grab attention or clicks to fuel my YouTube channel at all. Obviously, I'm just doing this for purely pragmatic, rational, logical. Of course, I'm just doing this for purely pragmatic and non-aesthetic purposes. And so I think it's safe to say that I'm being normal online still. And if you like my content, make sure to subscribe and consider supporting me on Patreon. Every cent that I get on Patreon goes directly back into making these videos. And the more money I make on Patreon, the more videos I can make because I have to work less. You get the idea. So I want to give a huge thanks to all of my Patreon supporters, especially Zala and the higher tier supporters. You guys really make these videos possible, and you've been a huge help to me. So thanks. Bye-bye. I'm going to be honest, it's a crack pipe.